about this. The next one that we're going to do, I'm just going to pick a time right now. How about the next one that we do is on Monday, and we will do same time. Let's do 12:30 on Monday. All right. Um, yeah. So let's get started. What we're going to start off talking about is non-surgical modalities or things that you can do to maintain your hair. So if you've noticed thinning, if whether you're male or female, obviously it's very disconcerting that first time that you notice that you're losing your hair. I remember for me the first time, I was 23, and I was living in Denver. And I got a really short haircut. I don't know what possessed me to do that, but it was like buzzed really short. And one of my buddies, who was probably 15 years older than me at the time, who was in the same residency program that I was in, was like, dude, you're losing your hair. You're going to go bald. And first it was like denial. I'm like, no way. Because I wasn't looking at what he was looking at the back of my head. But let's just say he was right. And through the years, I looked at different things. Probably 15 years ago, tried topical minoxidil. That's the first one we're going to talk about today. Or Rogaine. Back then, you had to squeeze it out of a dinosaur and put it in a wooden cup. No. But it was a different formulation than what it is today. And when I used this stuff, it caused a massive dermatitis. It actually burnt my scalp, and I had like chunks of like flesh, like dead skin falling off, the worst case of dandruff you've ever seen, and like quarter-sized chunks of dried scalp. Terrible. So I stopped that, and the years went on, and I finally saw this email that came across just in the last couple of years, about a year ago now, year and a half, that talked about ARTAS and the surgical hair replacement. So minoxidil is something that you can do, and what you want to do is you want to reverse the effects of and prevent future hair loss of DHT. So dihydroxytestosterone is what takes a hair follicle and causes it to miniaturize, and for that normal, full, robust terminal hair to get smaller and smaller and more wispy and more baby-like until it's a little piece of baby fuzz, and then it falls off and that follicle is dead. It's done. It's never coming back. CPR, defibrillation, doesn't matter. You're never getting that hair back, or the hairs that come with it, unfortunately. But if you use minoxidil, if you use topical Rogaine, you can actually reverse the effects as long as that miniaturized hair is still there, and turn that miniaturized hair back into a robust term. So minoxidil is one thing that you can do. Now you have to use it 8 to 12 months before you really visually see anything. And even if you don't see anything, it is preventing future hair loss and miniaturization and help minimizing that. So if you're losing your hair, male or female, topical Rogaine is a must do for you. The other one is finasteride or Propecia. Finasteride or Propecia, which is hard for me to say, is a pill. Now, if you're female, you can take this pill. It's a 1 milligram. Certainly as a male, you can take this pill as well. But if you are a female of childbearing age and have the potential of getting pregnant, you will not be prescribed finasteride. Finasteride is a prescription only, and it is 1 milligram a day. Now, there are some potential side effects. For males, and females, a decrease in libido. And for males, ED is a potential side effect of consuming and taking finasteride orally. It is perhaps the gold standard of non-surgical things that you can do to minimize future hair loss and to help reverse the miniaturization effect that's already occurred. Now, the third thing that you can do, well, let's do an in-between thing. An in-between thing that you can do if you don't want to take the pill is to get a combination prescription product that is topical of finasteride and Propecia. There is a very good study out of Europe that showed that the combination topical product works better and is synergistic with the combination just the Rogaine alone. For that product, you need to actually have it prescribed. So anybody that wants it, we will prescribe it for you. We need to, connect a little bit better than just doing this over Facebook, obviously. But what you'll do is you'll just give us a shout, give us a call. We'll tell you how to get this done. We can even do a virtual consult to make it official. We'll get you to fill out some paperwork, and we'll call a prescription in for you. The pharmacy will then give you a call. They'll confirm that you want it, and yes, they're going to ask you to pay for it before they formulate it, and they'll just mail it to you. You don't even have to go to the pharmacy. It costs roughly $200 sent to you, delivered, and depending on how thick you use this foam and how often you use it, which can be as little as once a day, and I like to use it in the shower. I apply it, I let it sit for 5 minutes, and then rinse it off. And it can last 4 to 6 months or more, depending on how sparingly you use it and how judicious you are with the application of it. Now, the third thing, and I want you to keep in mind, these things that I'm talking about are FDA approved. These are the things that have been researched and do what they say they're supposed to do. It's the laser cap or laser hat. Now, the laser cap or hat that we have delivers enough energy and power and is the maximum amount that you can get with the maximum coverage. There is a lot of junk. There's a lot of crap out there on the market. Is that doctor-like saying crap?
I don't.
Probably not, but it's true, and you know it's true. There's laser brushes, there's laser wands, there's laser toothpaste. No, but there's laser stuff out there that technically has the laser that does what it's supposed to do, and it is an FDA-cleared laser, but you have to deliver the appropriate amount of energy to decrease inflammation and to get the effects that you're looking for. If you do that, you get a 40 to 60% increase in hair counts in 4 to 6 months. It's a fantastic tool. You're either going to use it 6 minutes a day, 7 days a week, or you're going to use it 6 minutes a day, twice a day, for 5 days a week. So what I do is I have this laser cap in the car on the way to work and on the way home. I wear this laser cap. It has a battery. You don't need a very long plug-in and extension cord to make this work. It actually has a battery, and it looks like this. So mannequin, right? Cap. And this is what the cap looks like, and I don't know if you can get a good appreciation for this. The brand is Capillus, and the box that it comes in fact, we have one right here, is like this. This thing is warranted or guaranteed for 5 years. You can get it
They buy it through us.
You can get it through us. You cannot buy this online. You'll find Capillus sells other models, but it is not the one that delivers the maximum energy and maximum coverage. This is by prescription only through your doctor, and if you'd like, we can be that doctor for you. Just for tuning in today, you'll get $500 off of this if you wish to purchase it. You got to let us know you tuned in, though. Maybe leave a comment down below so we can prove it. If you actually have a surgical procedure here, it's actually $1,000 off this hat. The retail cost of the hat is $3,500. It is a significant investment. We do have some payment options available out there as well. So if you're like, yes, I'd like to, but can't do the $3,000 up front, we have some different options for you. So give us a call, let us know, we can work this out. Okay. Those are the non-surgical modalities. Now, as far as surgery is concerned, there's 2 different ways that you can get this done. You can do, actually 3. There's a strip where you make a linear incision, remove a section of scalp from the donor site, and then harvest those, process those. If you look in the back, you'll see, over in the corner, a microscope. Right over here, you guys can't see it. There's a whole room. That's a processing room to process those grafts to get them ready to be inserted into the recipient site where you want the hair to be. While we're talking, let's do this too. In fact, while I'm talking about this, I'm going to show you a before picture. Now, I have had a procedure in this area. That was the first procedure. And you need to wait about 8 to 12 months before you get the final results. So I'm not even at the final results yet, but not bad. I also have had this done more recently. So I'm not even at the final result up here yet. And then I've had this done back here because I had enough hair loss, as you're about to see, that I could not do it all at once. So this is a pre-operative photo of me. And maybe I could get one of you guys to hold this just while I'm talking. Just so that people can kind of see it. I'm going to try different angles and stuff and just gently move it around so they can kind of see. But I had like a significant amount of hair loss. We started by doing the hairline. Well, they can't see what I'm doing, but I should do it here.
Oh, right.
So we started by establishing hairline, filling in forelock and mid-scalp area back to about here. and the second procedure was back in the crown area. So really, the only results that you can see right now are just here. This is, I can feel little hairs starting to poke through, but it's really not visible because you need to get enough hair growth that you can really sit back and go, yes, that's it. And it's 8 to 12 months before you can celebrate the final results. Now, if you're using the laser HAP, if you're using platelet-rich plasma, you'll minimize something called shock loss. Now, shock loss is when you do a surgical procedure and you move a hair from point A to point B, the hair is going to shed or can shed. You'll minimize that if you use the laser HAT, you use platelet-rich plasma. So that's part of our process. You can do a strip, a linear incision, take a chunk and do that. It leaves a very long scar, has a significant amount significant amount of pain, swelling, and tenderness. The other two ways are either using a handheld unit or using the robot to harvest individual follicles. I think we can pull that away for now. We'll come back to it though, so don't lose it.
Okay.
All right. Taking individual follicles out and moving them from point A to point B, where we want them to be, the recipient site. The hand device works, but it's only as good as the operator, and you can imagine you get 2,000, 2,100, 2,200, 2,500, 2,800 grafts in, the operator's going to get tired, but the robot doesn't. So the real beauty of this is the precision of the robot from beginning to end, all the way through. I had this procedure done on a Friday, both times on a Friday, and was back to work on a Monday. I took no narcotics through the whole thing. Yes, it's a little uncomfortable, but regular ibuprofen does the trick. Okay, following postoperative instructions is also super important. These guys are better, and Shelby is much better at giving the postoperative instructions than what I am. But the overall concept is that these freshly moved follicles in their hair or hairs need to be immobilized. They can't be moving around during the healing process, particularly in the beginning. It's a wildly successful procedure. It's not a question of does it work. It works. There's a maximum amount that you can graft depending on the donor site and the recipient site at one point, at one time, in one sitting. So if you want a specific treatment plan for you, pictures after this, actually, if you look at this YouTube channel, there's some videos and instructions on how to send us pictures to give you a personalized version and an estimate, basically, and we can do this virtually. So if you want that, just watch those videos, do what they say, and send us the photos. Okay, so I've talked about the strip versus the robot versus a handheld harvesting device. On the day of procedure, we have to trim the hair very short. So you're going to have a high and tight haircut. For the men, this is less of an issue. The actual hair length is 1.3 to 1.6 millimeters. Let us do that haircut for you. Don't do it yourself. So 2 weeks before the procedure, no haircuts for you. We do that final trim. Now, generally speaking for women, we will do a full year of non-surgical treatment first. And sometimes the only option is a strip procedure. I don't do the strip procedure, but I know people that do, so we can get you connected there. For men, the hair loss is a lot more simplified. It's very predictable. It's called male pattern baldness. There can be a lot of other issues with women and thinning. So that's why there's a difference in timing and surgical procedure. So the vast majority of the procedures that are done with the ARTAS robot are done on men. For women, you can just shave a strip and have that underneath. But of course, the recipient sites, it becomes hard. So there's a lot of negotiating that needs to be done before you're doing this on women. So medical management is kind of where we're at on what I'm recommending currently, with an option of surgical management in the future. I highly recommend some level of commitment, and for women this is not a problem. For guys this is harder. The medical management, if you do this and you don't embrace something from a medical perspective, Rogaine topical, finasteride pill, laser cap, you're just not going to have as good immediate results. Long-term results can fade over time because the follicles and the hairs that are not grafted, can be lost, and it can just take away from your result, leading you to future sessions. Okay.
I think explain that they don't lose the hairs that you are
Right.
transplanting, but losing more that are around those
That's a
hairs.
good point. Yeah.
I think that's
So
the part
when
I
you
understand.
take the reason why we take hair from back in this area is because it is the stuff that is resistant to male pattern baldness. That's why people have hair, no hair here, have hair back in this area. We're taking those follicles. Now, in medicine, there is no such thing as 100%. These are resistant and generally you're not going to lose your own hair that you've grafted from here to here. But they may be at some level resistant, sensitive to DHT. So you want to protect against any kind of resistance, and more importantly, hairs that are remaining in this area that have maybe been the miniaturized hairs that are now normal, robust terminal hairs, because you have done this. If you stop, can then miniaturize and be shed or lost, taking away from your result. So, the hair that's getting transplanted is called permanent, and it is permanent, but you want to take all the advantages of the knowledge that we have to maintain what you have now and to get your maximum results. Okay, questions? Is there any questions that have popped up?
Not yet.
Okay. If you guys have any questions, just email us at Liberty Hair Restoration Center. That's info@libertyhairrestorationcenter.com. Look at the videos down below. They will also tell you how to get a hold of us. And look forward to talking to you and coming up with a personalized treatment plan for you here in the near future. Thanks, guys. I guess I didn't go back to the picture, but